Eric Eiting here live at the Digital Health Summit studio here at CES. I have Adam Gross with us here from RightEye. Adam, welcome.
Thank you.
Thanks so much for joining us.
Yeah, thanks for having me.
So talk to me a little bit about RightEye. What does your company do?
So RightEye is using eye tracking technology to revolutionize the way that vision tests are given. So right now, whether you're checking for a concussion and the neurologist is saying follow the tip of my finger, or you're going to the optometrist and you're getting a vision assessment,
right,
or you're getting a sports vision performance assessment. A lot of the metrics are very subjective. A lot of the equipment is very cumbersome and clunky and mostly disconnected. But the subjectivity is really an issue. And so we're leveraging the wonderful technology that's eye tracking, and we present stimuli on a screen, and we have scientific algorithms in the cloud, and we're able to deliver an objective, repeatable test over and over again, and every metric comes with a report for the healthcare provider or the coach and the patient or the player.
I think it's really exciting too. I mean, like we talk a lot about telemedicine and some of the innovations that you're able to make there, but I think that the eye is something that's often overlooked because people don't realize how innovative some of the technologies are and like some of the opportunities that you could use where you don't necessarily need to have that equipment right in front of you.
Well, you're right, and in the world of optometry, ophthalmology, and vision assessment, a lot of the equipment is really backdated to in the 70s and the 80s. You're talking decades old. And to bring it to the 21st century is something that we've been really well received by both the vision community, also rehabilitation hospitals, emergency rooms, sports teams, military customers. It's not easy to assess vision on a high number of people. The throughput is a difficult problem, and so we've got a simple setup. It takes only minutes to measure over 30 aspects of your vision, and everybody loves a report. So whether you're the healthcare provider
right,
or the patient, you get the report. So for the healthcare provider, it's documented evidence for the insurance company and for their decision making. And for the patient, it's better compliance. So if I'm getting therapy or I'm being treated for a concussion, and I get a report like this, I know where I stand.
Right.
And then as I get treatment, I can monitor the progress of that treatment over time.
I bet it's really helpful too for somebody who's just seeing their primary care doctor, but if they have diabetes and they need to have a screening of their retina, they need to make sure that their eyes are good and that that they don't have glaucoma or all the other screenings. It's got to be really great to have that information.
Yeah, we see a really tremendous opportunity and really a social impact opportunity in the world of vision screenings for children and underprivileged children especially. We really get overlooked. There's a study that was out that in Baltimore County, over 70% of the juvenile delinquents had undiagnosed vision disorders.
Wow.
So these kids just aren't being paid attention to. If we could get access to a short, simple, very cost-efficient vision test at a young age, we can get those kids treated. They can have confidence in school and learn how to read. They can stay in school and be better citizens and not take the road that they've been on.
Right.
And so, yeah, we think that's very important to us.
Well, especially with juveniles too, right? There's a long-term impact there. Tell us where we can get more information about your company.
So, website is righteye.com, RIGHTEYE.com.
Very good. Great. Adam Gross, thanks for joining us. I'm Eric Eiting, live in the Digital Health Summit studio here at CES.